second set is edentulous single arch. If the patient has an existing denture, these can be the simplest cases to proceed with. If the patient has a denture and it fits and it doesn't rock and the teeth are in a nice position, then this is basically your study model. With the denture, you will add either gutta percha markers, or you'll add the Sure marks. We need six Sure marks placed either on the buccal or on the tongue side of the denture. You just simply stick them. I'll show some images in a minute. You'll stick them to the denture and you'll perform a dual scan technique. If you have gutta percha, you can use a number 5 round burr, place holes anywhere in the denture, and randomly around the arch, six holes, and fill them with gutta percha and do a dual scan technique. This is our articulated cast. So this gray area, this gray denture here, this has some spray on it because we do scan it. But this is a printed, this is a resin printed denture from the CT scan. With these cases, you can send a flask of the denture, but essentially the simple records that you need are an opposing, a bite, a dual scan of the patient's denture, and the photographs. Those are the only records that we need for an edentulous single arch case. It's a very simplified approach, and you can see the photographs. This is actually a scan appliance. I think the patient needed a scan appliance. They did not have an existing denture that was ideal, but retracted left, right, and center photos. So those are all the records for single edentulous. The dual scan is the patient's denture or a scan appliance with markers. 1, 2, 3, 4. This has 5. Really should have 6, but 5 will work as well. And these are radiopaque markers about 1.5 millimeters in diameter. I put an X here because you do not need to send a cast of the denture. We have the denture, we don't need a cast of it, and even if we have a cast that we cannot articulate it, we do not have the intaglio surface of the denture. So if you would like to send us the denture as a study cast, then simply make a flask of it and send that in, and we can articulate that instead of the printed version. One of the most important parts of edentulous scans are that they are scanned in occlusion. So when the patient is wearing the denture in the first scan, it's in occlusion, the patient's not open and biting. It's also important that there are no soft relines. All dentures or scan appliances must be all complete acrylic, no soft relines. Soft reline in a cone beam machine ends up looking like a gap because of the thickness of it is closer to tissue than it is to acrylic. We always want the tooth position to be ideal, and we want the denture to not move, we want the denture to have a nice stable, like a hard reline or a new denture to fit stable in the mouth. So that was a single edentulous case. Double edentulous is similar to single, except it's both arches have scan appliances. Now this looks like 3, but there's a marker here, and there's a marker here, here, and here. So this case has 5 markers on the upper lower. Again, same principles. Both dentures must fit really perfectly. You do not want any rock or movement when the denture is seated by itself and to finger pressure. You don't want any movement. Perform a hard reline if needed. When the CT scan is taken, both appliances are seated in the mouth in occlusion. That's the first CT scan, in occlusion. Unlike dentate, which is out of occlusion. These are in occlusion. We do not need models for these cases. We cannot articulate a denture to a stone cast. It doesn't fit. We make putty models, and we articulate those in the laboratory. So these scan appliances, once scanned by themselves, they will allow us to export them in an STL file and simply print them and articulate them. That's how we make our articulated casts. So there are, in a double arch case, there are 3 CT scans taken, one with both appliances in the mouth, one scan of the maxillary appliance sitting in the scanner, and one of the mandibular. The scan appliances must not sit on plastic. I know a lot of the chin rests on these cone beam machines on the market have plastic as a chin rest. You should place a couple of cotton rolls or a piece of packing foam on the chin rest and put the scan appliance on top of that. That's critical. Dentures scanned on plastic will actually merge with the plastic digitally, and it's almost impossible to separate the two. So if you put a piece of foam underneath it, it'll appear that it's floating in space. And then down here in the image, you can see there's just a few circles, 5, 1, 2, 3, 4, 5 circles. Those are the gutta-percha markers that we see in the scan appliance. The denture may not appear at all in your cone beam when you scan it in the patient's mouth, and that's okay. It's still there. It's just plastic and it has a low density, so it doesn't appear. But you'll see the markers, either the gutta-percha or the radiopaque markers. So those are dual scan records. Again, photographs. Retracted, full face, full smile, and retracted left, right, and center. Those are the only items needed for double arch, cone beam, and photos. These are records that are not needed for double edentulous or single edentulous. Impressions of the dentures seated in the mouth, they're just not needed. We cannot do anything with these casts. We can articulate them, but we do not have the intaglio, so we don't know how they fit. So please, no casts. The only casts you'll need are opposing and a bite. And again, we have impressions sent of the ridges, which the scan appliances and the dentures both will not fit these ridges. It's just not possible. It's because it's soft tissue. So no casts, please. And then finally, partially edentulous with existing partials. So this is a very common situation. Patients have existing partial dentures that have already established the vertical positioning. Now in this case, you'll see the teeth are worn down. Probably need to make some new appliances. However, on the articulator, we may be able to mount this in centric and then open the articulator a few millimeters. But the point of this is that there are very specific records that you take for a patient with existing partials. One is capture the CBCT scan out of occlusion, biting on cotton rolls with no appliances in the mouth. These appliances have metal. You can see there's a palatal strap, there's a lingual metal, and then acrylic. This metal will exhibit so much scatter that we won't be able to work with the case. We won't be able to even see the teeth because of the scatter. So the first CT scan is appliances out, and that is the only CT scan. And then casts are sent. First casts that are taken are with no appliance in the mouth, and the second are study models with the appliances seated. And we will cross mount these so that we have articulation, and then we will bring that into the software for planning purposes. This was just developed this year. It's a very handy trick for patients who are just missing many teeth but already have appliances. Here's a case that was captured digitally. On the left-hand side, again, this is partially edentulous. On the left-hand side is of the patient without the appliance, and on the right-hand side, the patient with the appliance, and the same records, impressions with and without, and a CT scan with the patient out of occlusion, and without the appliances, and then of course the photographs, left, right, center, capturing the bite and the tooth position, how they come together. I placed a red note on here for caution. If the patient appears to have issues with the bite, they probably do. And when it comes to the laboratory, we will always question them. We have a team of dental technicians and even dentists who review these cases as soon as they arrive to see if we have the proper necessary records, to check bites, to check vertical space against the patient's full face, full smile picture, for transition lines of prosthetics. We have numerous checks that we go through before these cases are launched and the green light is go. So we recommend that anytime a case is just show some pictures of some cases that were just all captured at on the same day here at the laboratory. We recommend contacting us with photographs or with digital impressions. Send them over, and we can have a conversation about certainly about bites, often about space needed, that depending on case by case. But we can move along quickly with just some photographs alone. Thank you very much for watching this video. It was lengthy, but it's very important that we start off in the right direction with records. Please feel free to contact us anytime to discuss your records and how to move forward with a Chrome case. Thank you again.